Okay, let's talk about how to improve your sperm counts. So to understand this, you have to think about it from an evolutionary standpoint. If your body feels that it's fighting for survival, it's not going to allocate resources towards reproduction. So all of the advice I'm going to give is pretty much general health advice that any doctor would tell you. These are the things that make your body healthy and make your body feel that you have enough resources around. Your life is not in danger, you're not under too much stress, and maybe it's time to reproduce. So the first one is sleep, right? Sleeping 8 hours a day helps your body to recover, helps you feel refreshed. And when your body is sleeping 8 hours a day regularly, then it can allocate more resources towards reproduction. And chronic sleep deprivation has been shown to hurt sperm counts. Now, number two, along with that, is stress. Being under a lot of emotional, psychological stress makes, again, your body feel that it's fighting for survival and it's not time to allocate resources to reproduction. So that will decrease your sperm counts if you're under chronic stress. Number three is exercise. Doing some exercise every day is very healthy for you, especially if you can do that outdoors. Outdoor time in men has been shown to improve testosterone levels and likely improve sperm counts. It also helps to reduce the risk of depression and psychiatric conditions. So if you can do a 30-minute jog every day, that will have a huge impact on your fertility levels. Four is diet. It's been shown that ultra-processed foods have a negative impact on fertility in men. So eating a diet that's rich in fruits and vegetables, low in inflammatory substances, this again will help improve your sperm counts. Now, it's important to note that the sperm production takes about 70 days. So any changes that you make need about 70 days to take effect. So the best prescription I can give somebody with borderline low sperm counts is a 70-day vacation. Obviously, nobody can afford to do that, but as much as you can to really focus on your personal health and well-being, this will improve your sperm counts. Everything else is secondary. So there's a huge multi-billion-dollar industry in supplements. A lot of these supplements claim to help improve your testosterone levels, your sex drive, your fertility. Most of them are BS. They don't have any evidence, true scientific evidence supporting them, and they're not regulated at all. So they can make whatever claims they want, and they can basically sell you whatever they want. Nobody knows that what's actually in that pill or powder that you're buying is what they claim it is. So I would try to stay away from those. There are some supplements that have some scientific evidence to support them. The main one would be coenzyme Q10. This is over the counter. It's a little bit expensive, but aside from that, it's pretty much harmless, and there's some evidence that it might help a modest amount in some men improve their sperm counts. Two would be zinc. Just a normal zinc supplement that you would find in a men's daily vitamin likely helps improve the semen volume and likely the fertility rates, although it's probably, again, modest. There's some evidence for L-carnitine and some evidence for selenium. These things are things that you'll find in a men's multivitamin. So these are not game changers, but they're probably harmless and they might help a little bit in some men. Things to avoid would be hot tubs, right? That increased temperature of the hot tub on the scrotum can have a negative impact on sperm counts. So again, if you do a hot tub once in a while when you're on vacation, it's probably not going to be a big deal. But if you're a guy who's spending a lot of time in hot tubs regularly, that could be something that you might want to avoid going forward. The other one is finasteride. This is a common drug that's becoming more and more popular for male pattern baldness. You see hymns and people selling these things. Now, at the standard dose for male pattern baldness, 1 milligram per day, it probably doesn't have a significant impact for most men. But if you're struggling with fertility, I would probably avoid it. At the higher dose, the 5 milligrams per day that we give for men with enlarged prostates, that has quite a bit of evidence showing that it'll have a negative impact on fertility for a lot of men. So I would definitely avoid that. The other one, which seems obvious, is any form of testosterone replacement, whether that's legitimate testosterone replacement prescribed by a physician. That will cause a huge decrease in sperm counts in most men. You definitely want to avoid that. But the corollary of that goes back to the supplements. A lot of these supplements that you buy online may have testosterone in them, or may be affecting your testosterone production in a way that could be counterproductive to your sperm counts. So in summary, I would say to do all the things that you've always heard are good for you. Sleep as much as you can, at least 8 hours a day. Try to avoid a stressful lifestyle. Try to avoid processed foods, eat a healthy diet, exercise regularly, spend time outdoors. Maybe take some of these supplements that have a modest impact. And any change that you do, again, you're going to need to do it for at least 70 days. And if you sustain this change in lifestyle, you likely will see an improvement in your sperm counts.